Welcome to the Podiatry Profits Podcast, where you will discover how to get more patients and multiply the profits of your practice with minimally invasive foot surgery, proven marketing systems, and ethical influencing to your patients. And now, your host, board-certified podiatrist, best-selling author, speaker, and founder of TJ Ahn Coaching and Consulting, Dr. TJ Ahn.
Hey, this is Dr. TJ Ahn here. In this video, or in this segment, I want to talk about secrets of influencing or persuasion, communication skill with your patients. Now, persuasion and influencing, they're well-known subject, and a lot of books and videos and courses they cover this part in terms of more marketing, like traditional sales, negotiation scenarios. But how do you influence your patient's decision making, and also how do you persuade your patients ethically? We're talking about ethical persuasion, because I'm assuming you are a physician, surgeon. You want to help your patients, you want to fix their problems, so you are ethical. Assuming that because if you really start understanding persuasion and influencing, it could be it could become dangerous if you're not ethical, because you will be able to change your patient's decision making. So anyway, that's my pre-assumption that you are ethical. You want to help your patients. So even if you're a good doctor, good surgeon, you have a great solution that you can help them fix their problem. But if you do not know how to communicate with your patients, that's a problem. Especially if your practice is based on insurance model. And as most doctors, we are trained, whether you know it or not, consciously or subconsciously. I know more than 95% of traditionally trained doctors, their practice model is based on insurance. So if insurance doesn't cover certain service or treatment, it definitely influences doctors' thinking, judgment skill. What am I going to do if insurance doesn't cover? What do you do? Do you change to different second alternative treatment plan? Is that ethical? That's some question that you might ask yourself. Do we really provide or offer the best treatment solutions regardless of insurance situation? So anyway, to understand that influencing and persuasion, I want to give you some basic in this episode that I call patient's journey. It's coming from the idea of buyer's journey, right? So if you understand this quick explanation of patient's journey, it might open your eyes. So rather than doctors focusing on patients' problem and trying to diagnose and give them solution based on diagnosis, what if you look patient's problem and as a whole, as a part of their lives, patient's life? So for example, let's say, because I'm a podiatrist, as you know, I'm a foot surgeon, minimally invasive foot surgeon. So let's say patients have a bunion. And are you focusing on bunion? And again, it's all traditional insurance-based model, ICD-10 and CPT code. My treatment for this patient after you diagnose this as a bunion, okay, you need a bunion procedure, or you need some conservative treatment to control this bunion. So you're totally focusing on that problem only, but I want you to start looking at patient's journey. So here's where they are right now, is point A. And then you want to communicate with your patient, what if there's a point B where there's no more problem with that bunion? Now, is that only bunion? Answer is no. You need to discover deeper level with your patients during your consultation phase or your that patient's visit. You do need to go deeper than just addressing that actual physical problem with the bunion. That means you have to go into what other aspect of life that this problem affects this patient. Family level, financial level, the activities they love doing level. So you need to tap into patient's emotional level, that it helps you understand what patient is going through. And while you're discovering this deeper level with your patients, even if patient presented with a bunion, patients will start seeing you differently. Oh, no other doctors have treated me this way. They really wanted to know what's going on with this, my life, because of this problem that they presented. Does that make sense? That's the foundation level of ethical influencing and ethical persuasion. Of course, it is much deeper than that. I have taken many courses, many training courses, mastermind group, events. Over the years, I visited well-known, successful plastic surgery practice, dentistry practice, not only in the United States, but also South Korea, where I am originally from. So this is that experience and wisdom and the accumulation of my effort. Okay, so, and then I applied to medical practice and podiatry practice. So these are really the fundamental foundations of ethical persuasion. And I just wanted you to hear me out about this part, patient's journey. How can you help your patient from point A, where they are right now, to point B, the ideal position of this patient when this problem is gone? What else it will change to your patients' lives? So think about it that way. And then again, I just wanted to make this quick video, or that you might be listening in the podcast episode. I'm planning to give a little bit more and more, but if you want to obviously take your practice to the next level, if you want to communicate with me directly, see what I can help your current practice, not only MIS, but I can help you with the marketing, and like I said, in this ethical influencing persuasion, setting up hybrid concierge model. So various levels I can help you. If you just, instead of passively listening in to or watching in my YouTube videos or Facebook Live or podcasts, you actually want to contact me and interact with me, I'll put some contact information below, or further information you might want to delve into. And otherwise, I'll see you very soon.
You've been listening to the Podiatry Profits Podcast with Dr. TJ Ahn. To find out more about Dr. TJ Ahn or discover how you can grow your podiatry practice, visit drtjahn.com. Or you can also get a free copy of Dr. Ahn's best-selling book, Opt Out: How to Take Back Financial Control of Your Private Clinical Practice Without the Hassle of Insurance Companies. Just go to optoutbook.com.